Well, new treatments are helping people with Parkinson's disease live life to the fullest. And here to tell us more about that is Dr. Eleanor Orehek with Neurological Clinic in Abbott Northwestern. Thank you so much for being here.
Thanks for having me on.
We'll start with the basics. Just what exactly is Parkinson's disease?
So Parkinson's is a complex disease. It causes changes in the brain that causes loss of nerve cells, and that can result in things like tremor, which is one of the more recognizable symptoms, but also difficulty with walking and changes in voice that are a problem, and then mood symptoms and other non-motor symptoms can be a part of it as well.
Symptoms can really vary for people.
Exactly.
Yeah, case by case. Treatments, I know there's a lot of different options out there for treatment, or what does that exactly look like for people?
Yeah, so we have kind of three main areas of treatment. So the first one, I always start off with exercise, because it's people become numb to it, hearing about doctors talk about exercise, but we're learning more about why it's important for diseases of the brain, and so I really make a point to talk to my patients about what they're doing specifically and recommend treatments like boxing and classes that will help them stay motivated. So.
Yeah, what does that do for them, that movement? I mean,
it's a movement. It also can be protective for the brain cells, so the intensity of the exercise we feel is important, so that's something we talk about. And then
other thing, you mentioned there's three things.
Yeah, so medications would be the other area, which have come some ways over the years. We have different delivery methods for the medications to help manage the symptoms of the disease. And then the third one would be a surgical procedure, so that's called deep brain stimulation, or DBS. So that's a battery that's connected like a pacemaker, but it goes connects to wires that go into the brain and stimulates areas that help with the motor symptoms of Parkinson's.
We talk about new things, like things on the kind of the cutting edge when it comes to treatment. Are there certain things that come to mind when we're talking about that?
So there's some promising things. One area is looking at antibodies and vaccines that can target the abnormal protein that starts becoming a problem in the brains of Parkinson's. It's called alpha-synuclein. So we feel like targeting that will help actually treat the disease, because we don't yet have a treatment that will actually slow down the disease progression or cure the disease. So that's kind of what we're looking for.
Yeah. I just listened to an interview, Alan Alda, a well-known actor, just opening up publicly not too long ago about his struggle. He's been diagnosed with it. Has an incredibly uplifting attitude and approach to living with the disease. How much does this help to have guys like this being so vocal about it?
I think it's really important, especially the way he did it, talking about how positive his story is and inspiring people living with it, and then increasing awareness in the community and helping us have conversations about it and lead to hopefully new and better treatments and advances in the deep brain stimulation and other areas that have really been helpful for patients.
Really quick, we don't have not much time, but for anybody out there, maybe them or a family member is diagnosed, what's the biggest thing you want them to hear?
It's important to find a good neurologist that specializes in Parkinson's, because it is a complex disease, so sorting through what is Parkinson's and what's not is challenging. So it's good to find a good specialist.
A lot of hope out there, for sure. Thank you so much for taking some time with us here today. If you want more information on this, we have it for you at KARE11.com. We're going to post this segment. Also a link to Abbott Northwestern's website right on our 4 p.m. show page, so go check that out. We'll be right back. Stay tuned.